Sean, let's make a start. Good afternoon, everybody. I'm Minesh Khashyu, and I welcome you to this special safety forum session. We had ordinarily planned one of our routine safety forum sessions, but in view of the current difficulties on the front line, we decided to leave that program for later. And today's sort of next hour and a bit is largely focused on staff safety and staff well-being, which is obviously a key an important area that we perhaps need to focus more on and invest more time and energy in. So I'll be talking a bit in terms of scene setting. And as most of you know, I'm the clinical advisor for Maternity and the Regional Southeast Safety Champion. We'll follow that up with a special session on what we call spaces for listening, and that will be led by Charlie Jones and Bridget Russell. They will introduce themselves. I don't want to steal their thunder. And then following that session, we'll have a bit of an exploratory conversation regarding staff safety and well-being. There's a few slides I will go through, but more importantly, it is about you asking questions of the forum in terms of what you want in terms of staff safety, what currently resources are available, how can we help each other, and focus a bit more on our own well-being and safety, which can sort of take a back seat in a lot of the chaos we are in today. And next slide, please. So I would like to start by a very heartfelt thank you to all of you. I think the last 12, 18 months have not been easy. And we have all, despite all the difficulties, continued to serve our patients and our families. And I think we perhaps don't, at a system level, at an individual or team level, take enough time to pat each other's back, to congratulate ourselves for all the work we have been doing in the last year or so. And so I think it's a moment for us to pat each other's back, to make sure that the appreciation for each other's work, for different parts of the same organization working towards the same goal. I think we perhaps need to spend more time and reflect a bit on what has happened in the last 12 months or so, and really be thankful to each other's work, to each other's companionship, and continue to motivate and support our teams through this difficult time. So thank you once again. Next slide, please. This is a slide from, there's a couple of companies, and I'm sharing some slides from different companies, not with the idea to advertise those companies, but just to give you an example of what is happening in the health and well-being space. And this is an interesting slide for a new company, a startup company that has come up in the UK called Tahora. And it raises quite an important question, because in the busyness of our lives, we just will sort of in almost sort of automatic mode ask people how are you, and they will just respond the usual everything's fine or I'm all right. And I think we don't do the second question here generally. It's a quick sort of glance towards somebody, eyes contact, and just how are you, I'm fine, and we move on. So I think it's the second bit we perhaps don't do. And perhaps one of the main learnings from today is, are we spending enough time with our colleagues, even with our family members, whatever our social circle is within these sort of restricted times, to go to that second part there, how you really are. I think that's quite an important bit, because we are all busy, but we need to take time to look after each other. Next slide, please. So this again is it's a slide. I'm going to get you to read it. It's a focused on all right, and I found it quite interesting. So take a minute or so to read through it. So this is a simple tool or a simple set of suggestions that we all can do on a day-to-day basis to help support our colleagues, our family and friends. And we'll perhaps pick this up again later in our discussion. Next slide, please. So this is an interesting graphic which shows what happens following a disaster. And so we have the impact phase, the heroic response at the individual or community level, then perhaps a bit of community cohesion through a honeymoon period, and which is followed by a disillusionment period, which might again have some trigger events. And then it takes a while for reconstruction to happen. What is interesting is this slide doesn't consider the fact that the initial event might last itself longer than a year or so. With COVID now, this slide is almost irrelevant in the sense that the initial impact itself is so long and sustained that we almost need to create a new graph, a new way of looking at it. But I just wanted to share this to make us understand in how uncharted type of territory we are in terms of the current pandemic. But while some of these ups and downs will again be seen in our response at individual and community level to this pandemic, we need to understand that this is something that hasn't been experienced before in terms of a prolonged event, and the risk is that a lot of that disillusionment and phase is going to get very protracted, and it might be a while before the reconstruction phase begins, so to say. Next slide, please. This is another useful slide. So some of these slides are from organizations that don't know well. So it is up to you to make sure they are fit for purpose. The reason I'm sharing them don't necessarily validate for your individual use, and some of them are private companies. So I'm not trying to advertise their work, but I found this quite useful. So have a read through this, and again, it might be a useful resource for you at an individual or team level. As you well know that the session will be recorded and slides will be shared. So if you haven't managed to get into some of this detail, feel free to email Sean, or we will in the course of the next few days be sending out the recording out anyway. Next slide, please. So this brings me to an important part of today's session, which is something called Spaces for Listening. It's a pleasure to invite Charlie Jones and Bridget Russell, who I've known for, I would say, the last, I think Charlie for perhaps the last 6 months or so, and Bridget maybe for the last couple of months. I will let them introduce themselves, and it's all yours, Charlie and Bridget.
Thanks, Minesh, and thanks for this opportunity. I should say you might get some background noise from me. I'm not where I thought I was going to be this afternoon. I'm in Southmead Hospital in Bristol, but I'm in more of a clinical area, so you might get some banging doors and chatter. So I'll try and be as clear as I can. It's just really lovely to be here with everybody, and good to see you, Minesh, and yeah, it's helpful to have that context that you've gone through. So we've got some time to talk about spaces for listening, and I think Bridget and my style will be to just kind of talk about it and engage with anybody who wants to engage and see where that brings us to. I think just picking up on one of your slides, Minesh, that the couple of slides ago, I think it made me think that I imagine most of us on this call, we're pretty good at looking out for others. and maybe there's some tips we can use around how are you really. But I think essentially this is what we do. This is what we train for. This is where our hearts bring us. We're good at caring for other people, looking out for other people. I think it's a completely different beast when we think about how am I. Really ask that, how really am I, and pause on that. And I think I've been a clinical psychologist for 15 years, and I think a kind of clear theme in my time in the NHS has been that sense of people who are very good at giving care are perhaps less good at caring for ourselves. So I think that's important context. And I think, your other slide that you put about, I think a starting point is that this is a really painful time that we're all in on many, many levels: family, work, identity, and this idea that we're in the same storm but different boats. I think that's, I think most people would agree with that. And there are a whole load of well-being measures and initiatives around individual resilience, coping. What Bridget and I have been aiming for has been something that's more around connection and something more about relationships. So I think our starting point is that we accept that things are really challenging, but let's not face that challenge alone. So I was going to move on to what is it. Bridget, do you want to say anything at that point around background?
Well, great to be here, and just to say I'm joining you from a very sunny Stirling in Scotland, and delighted to be here. And I'll let Charlie do the introduction, and then perhaps about the approach, and then perhaps chip in if that's okay, Charlie.
Okay. So what is Spaces for Listening? So in my work as a psychologist, I do a lot of group work, and my work's been very influenced by someone called Andy Bradley, who has developed something called compassion practices, and something in particular called compassion circles. So Spaces for Listening very much kind of its roots are in compassion circles. And also the other influence is Nancy Klein's work on thinking environments. I don't know if that's familiar to people, but essentially the underpinning principles are rounds. So when you go round in a group and people take their turns, equality of participation. So everybody gets the possibility of the same amount of airtime, and the facilitator participates. So it's not an expert model. The facilitator is as much of a participant as everybody else. And a light structure. So that's the kind of the principles behind Spaces for Listening. And what happens is 8 people gather on a Zoom call, and it takes about 50 minutes, and we have 3 listening rounds. Sorry, doors banging. And in each listening round, everybody gets 2 minutes in turn of uninterrupted time. So the prompt as we go in the first round is, how are you and what's on your mind? And then the person gets 2 minutes, stops, next person, 2 minutes, next person, 2 minutes. And then when everybody's had 2 minutes, we move to the second round, and the prompt is, have you any reflections or feelings in the light of round 1? And then in the third round, the prompt is, have you anything you want to take away from the call, and has anything resonated that you've appreciated? It's a really simple prompt, and participants can say whatever they like in their 2 minutes. They can talk about work, about home, about the world, about politics, but they just get 2 minutes. And at the end of 2 minutes, the facilitator would hold their hand up like this just to say, stop talking now. And then we move on to the next person. So people don't say, oh, Charlie, when you said that, I thought this, and have you thought about doing... It's not an advice-giving session. It's not... people can follow someone else, but there's no set. It's not really a conversation. It's a series of timed sections where people get to speak and everyone else listens. So, and as I say, the intention is around connection. So connection to self and connection to other people on the call. And the feedback we typically get is that people describe a sense of connecting to similarity, but also honouring difference. And we very much frame it as about listening rather than about well-being. I suppose, in a way, it's semantics, but I suppose my sense of working in healthcare is that calling it a space for listening feels more accessible to people. I think well-being, compassion, I think that can be either triggering or put some people off engaging with this kind of thing. And so calling it a space for listening, I think, feels accessible to people. And we've done groups with groups of strangers. We've done it with teams who know each other. The key thing is that people choose to participate. So no one should ever be kind of coerced into taking part in something like this. We spell out at the beginning that people might get emotional and people can say what they like. People can pass if they want to. So there's no obligation to bare your soul or anything like that. And just the last thing I'd say, just before you go, Bridget, is just something that's really powerful that comes out of it is around when you're listening. There's just something really powerful about listening and feeling like I don't have to do anything here. I don't have to fix this person. I don't have to jump in and suggest anything. And it's also really powerful to speak without being interrupted, and know that you're not going to be interrupted. And just know that what you say will be kind of honoured. So I'll just leave it there for now. Bridget, do you want to chip in?
So I'll just pick up from that, Charlie, and I just want to share two examples. They're both uppermost in my mind. One because I've just come from a call with one of the groups, and the other because the other group have just written a blog. So the first I wanted to start with is we have a blog that's just been written by colleagues in the Simon Community Scotland, which is a charity for people who are homeless. And the reason I wanted to share that example with you is, and it picks up on some of the themes that Charlie's talked about, in that the colleagues who've introduced the approach, Spaces for Listening approach in their charity, is that they've said these are people who are working, throughout the pandemic, they've been working with people who are homeless. They're under enormous pressure. And this was the first time that they were pausing to give themselves and each other some support. And what they've really emphasised and brought alive, I suppose, in their example is that they're meeting as equals, that they are seeing that listening to each other, as Charlie said, without the need or any expectation of fixing things for each other, that is actually essentially incredibly kind, and they experience it as real relational kindness, the support to each other, that connection. And one of the things that we get asked a lot, which I think our colleagues in the Simon community have really addressed, is this safe, and what about the risks of people being upset or of sharing things that are upsetting? And they sort of faced that issue head on by saying it's safe enough, and actually we can create a space that is safe between us because we're adults choosing to come together to listen to each other and to be heard. And I suppose just to add to that, the other example, I've just been talking to colleagues in one of the health boards in Scotland who are also just introducing the approach across their health board, and they've talked really compellingly about the power simply of almost more of the power of listening to others than the power of being listened to. There's something really quite restoring and liberating to listen to other people and to feel either affirmed because their experiences are very similar, or just actually to learn something from hearing how somebody else is approaching what they're facing, and that in itself is. There's no obligation or need, as Charlie said, to do anything for each other, but actually by listening to each other, we are doing a lot for each other because we don't often have that quality of listening in other interactions. And one of just the last point on that, the person who's kind of convened the call I've just been on said, every time he's either in a space for listening or talking about it, he has a sense of calm and a space to actually pause and feel a bit differently about what is he's in a general management role in a very large health board and enormously pressured job. So I think that says something in itself.
I think where to go next with that. I mean, I think something about spread. I know Minesh, you came to a session, and I think I remember something. If it's okay to say, Minesh, I think you said something like, "You don't need training to be a human being." I thought that was an amazing thing you said at the time. And I suppose the point is, while Bridget and I are in all of these spaces, what we've found from organisations that have embraced this approach is that it doesn't need to be a psychologist, it doesn't need to be anybody. It's anybody who's got the kind of disposition to be with a group and to kind of be relaxed in the presence of a group of people. It's the structure and the prompts that holds the space. So this isn't about experts bringing in, people have said to us, how much does it cost? What's this is just people. It's people coming together. The difference is from all the other meetings we go to is it's got this light structure. It has rounds, and you're not kind of trying to get in because you know where your turn's coming. So there's a very light structure, just enables 8 people to come together and have a very different experience. All of us in a Spaces for Listening, we spend all our day in meetings, but these are very different meetings because of the structure. But it's not because of Bridget and me, it's because of the structure.
And if I might just add to that, Charlie, because it's a conversation that I've just been having with this health board about how do we do this? How do we spread or offer this more across an organisation? And we were really clear in that conversation. It's actually not about rolling something out in a top-down way that's done by a group of experts to people. It's actually organic. And it's about the best way that it can spread or ripple out is where people who have experienced the Space for Listening then take it into their own team or into groups that they're a part of. And I think one of the things to sort of emphasise is we're not saying that it's the answer to everything, but it's an answer that sits alongside other offerings. But right now, our sense is, perhaps we always needed this, but right now, all of us need a space in which we're able to share how we are feeling, what's on our mind, how we're approaching things, and it's a space to do that amongst peers. And then maybe some of the organisations that are taking this on, how they've positioned it is to link to or to signpost other things that are on offer within that organisation, which might be somebody might need more one-to-one time, in coaching or some other kind of support. But what this offers is a space for peers to connect with each other and to listen, and then maybe it enables each of us to think about what else we might need to access for support.
Minesh, we can keep talking, Minesh, or do you want to kind of open out to questions? And because we're happy to flex whatever's going to be helpful. Do you think we've spelt out enough what it is? Or do you want us to say a bit more about that?
No. I think that was very useful. Thank you, Charlie and Bridget. So I think you have apart from actually doing a demonstration, you've done everything else that you possibly could. So I think it might be useful for us to open the forum for questions so that people can ask you specific queries, and then we can move forward. And obviously there's also I guess, and I'm sort of saying this on your behalf, an open invitation for people to get in contact with you if they wanted to try it out for themselves individually first before they can do it for their teams and stuff. So yeah, let's open the forum for questions, and I'll try to moderate as much as I can in terms of making sure the people who start first get the first go. Shan, go ahead.
That was really interesting. Thank you. Would you be able to run through this structure just again? Because you mentioned at the beginning, but it was quite difficult to catch it all just initially.
Yeah, thank you. Yeah, sure. So say a session's at 2:00. So the 8 people, Bridget will have in advance sent out the Zoom link to so it's 6 people plus Bridget and me. So 8 in total. So the people arrive, we have some chat as people are arriving, and then on the 2:00 we start, and we spell out that there are going to be 3 rounds, and in each round everybody will get 2 minutes, and we go through the order. So it's, Bridget will go first, then it's Minesh, then it's Sean, then it's Charlie, so everybody knows where they are in the order. And then you say, right, so we're going to get started. The prompt in the first round is, how are you and what's on your mind? Bridget, over to you. And then her 2 minutes will start. And at the end of 2 minutes, hand goes up, move on to Minesh, his 2 minutes up. So Minesh wouldn't be commenting on what Bridget said. He would get his own prompt. Minesh, how are you and what's on your mind? So everybody gets that in the first round, end of first round. And then in the second round, the prompt is any reflections or feelings in the light of round one at a time. And then in the third round, it's anything to take away from the call and anything that's resonated that you've appreciated. And then when the 8th person in the third round has finished, that's the end of the call.
And Sean, if I can just one thing to add that we haven't said is we don't do any usual introductions at the beginning of the process. So we don't introduce ourselves by role or organisation or anything. We just go straight into the listening rounds. And what people have, our own experience of that, but what others have said to us is that that's actually very liberating. And what it means is that we're a group of 8 people speaking to each other as people, not roles. And of course, it's totally within someone's choice whether they share anything about what their job is or what their organisation is. But most people don't, and it's quite natural to just answer those prompts without reference to job title. And so what that means is it really gets away from status and hierarchy and allows a real human connection.
Thank you. And we've also got a question in the chat from Avida. I don't know if she wants to put her hand up or just take and ask.
Oh, thank you. Thank you very much. This is a very, very obvious question, that probably we don't have 8 member of staff. We have loads. That potentially this program will help and benefit everybody. My only worry is it sort of how much it costs per trust? Would you consider it as something that is a trust based on the employee numbers in maternity? Would you I don't know. I'm just asking. That's all.
So, Avida, you're asking? Do you mean financial cost or time?
Of course.
Yeah, no, there's no cost. This is just a structure that you can experience and then think, would this work for us? Right. So from Bridget and my perspective, if someone in your area experiences it, we feel that's enough to go ahead and get on with it. You don't need so I'm not here to knock Schwartz rounds. We've got Schwartz rounds. We love Schwartz rounds, but for that you don't need to go and get some 3-day training that costs 10 grand. It's a group of people we come together in a pub or around a campfire. It's just a conversation, so there's no cost.
Oh, perfect. I email you straight away. Thanks.
Would you be okay if you put the emails in the chat at the end of the session? Bridget and Charlie. Thank you.
Yeah.
Any other questions?
Minesh, do you want to say a bit about your experience of it? It's putting you on the spot.
No, I think, as you said, I found it quite liberating, and I think it's something you have to do. Unless you do it, you don't. I think you can explain it, but there's a limitation to words. You have to experience it, and in a way, it's quite simple. But that's the beauty of great things. Great things are simple. They're not complicated. You don't need to write an SOP on it, and because we have enough SOPs anyway in our lives, so we don't need another one. And I think the other bit is it can be self-perpetuating. So if I like it, I can use it in my group, and then somebody else picks it up and they can use it in their own team. A group of maternity people can get together and do it, and they can maybe get somebody from anesthetics, somebody from theatre, somebody from the community, and so that way it will grow organically. And I think one of the key things for people to understand is it has a very loose structure, but that structure is quite important. It's not a chit chat. And I think at the end of the day, listening is a very important skill for life. I think we don't perhaps, especially with the current social media and stuff, listening is actually getting worse and worse. Because people just want to quickly do stuff. So the capacity to shut up for 2 minutes and hear somebody out, it might seem easy, but actually it isn't, because we have gone into very bad habits. And the other bit, which I think Bridget already highlighted, is the fact that it doesn't really need governance, and which was partly what I said when I joined you guys, is I don't need training to be a human being. I think we've become a bit too focused on process and governance in the NHS, and yes, there will be situations where it could trigger somebody, but at the end of the day, that could be anything that happens during the day. So we should, as human beings, be able to manage that at a human being level, rather than at a sort of have a sort of industrial 400-page SOP to what happens, how do you escalate it, how do you so I think some of it needs to be demystified. And at the end of the day, people need to try it out. It will work in some situations, in some groups it will not work, and if they find there are any weaknesses, or if they find there are some issues that get highlighted, then there are ways to mend those. They can get in touch with you, or they can talk to some other colleagues and take it forward. So I think it's a simple tool. It's free to use, and I think the more important thing is, which is quite important actually, is the focus on agency as the individual. I think it's not something that Charlie is putting on the plate for you, or Bridget is putting on the plate for you. It's self-service. You can join one of your sessions, but at the end of the day, it is then self-service for yourself, for your own team, and then that serves somebody else, and that serves somebody else. So I think a big problem in our country, to be quite frank, at the moment, is also that people seem to be too focused on what is A and B doing for us, rather than what I'm doing for myself or what I'm doing for my community. So I think we need to get better at that, and be in a way a lot self-reliant with some of this.
Can I just say about community there, Manish? That just prompts me to,
yeah.
One thing, if people are interested, we have a maybe monthly, 6 monthly, people who are taking this forward are gathering together into a kind of informal community of practice, where together we kind of just troubleshoot things that might happen. Oh, this situation came up, what would you do? Because it's, there's no manual for this, but I think, all the different organisations that have embraced this, we're gathering together on a regular basis just to form a kind of informal community of practice where we can check in with each other and see how it's going.
Yeah, and just to add to that, Charlie, and picking up what you said, Manish, that I was with one of the organisations just now, and on the call they had, so they're a health board in Scotland, and on the call we had a person in a health board in Wales who has rolled this out there, and they've connected up. And so actually, for all that we talk a lot about the challenges we've had of working remotely and virtually over the last year, what it's really done is opened up the chances to share experiences and connections across the country. So, we'd never have done that before between Wales and Scotland, and the community of practice gives us a chance to do that across. It's not just health organisations actually, but it's largely health and care and third sector organisations across the country. So.
Oh, yeah, that's useful. Any further questions for Charlie and Bridget? Let's give it another minute or so, and then we'll move on.
We've got some hands up. Vida again.
Yes, can I just quickly? Oh, sorry. It does look like I'm very, very interested, which I am. It's nothing to do with financial interest. Sorry. The thing is, how quickly are you sort of available? Is there a waiting? Because I'm sure that somebody should do the first session. So Are you available? Do you have a sort of time sort of schedule that will be available?
Well, right now, so we offer 2 or 3 spaces for listening every week. We've got 2 next week, that still have a few places in them, and then we basically do 2 or 3 every week, and you'd be very welcome to come along to one of those. It's a bit different in March in that we're doing it as part of an event, but we will still have spaces during March, but we're carrying on beyond that as well. So we can share dates with people if you get in touch with us.
Thank you very much.
Leslie also has a hand up.
Yeah, go ahead.
Thank you. Yeah, really, all sounds really interesting, and keen to learn a bit more, and in particular your community of practice, and whether there's people within the Wessex region or Thames Valley and Hampshire Thames Valley that are already using this model. You're shaking your head, Bridget. Are you not? No. Okay.
No, there isn't. Not yet, but you could be the first.
Okay. No, that would be good. All right. Thank
Sorry,
you.
I'm the first.
After you then.
Okay, good. That's useful. Charlie and Bridget, are you happy to stay on for a bit, because there might be a bit more discussion towards the end. So as long as you're happy to tag along, we'll go back to a few slides and then we'll have a discussion. Thank you. Thank you very much for that. So Sean, if we go back to the other slides, please. Yeah, that's go ahead. So we'll I'll run through some slides, but it's largely we need to focus in the next sort of half an hour on a bit more in terms of what you guys think about your own well-being and your colleagues' well-being. What are the particular types of things you might have tried? We'll signpost you to some of the newer stuff that is happening in terms of health and well-being, and feel free to shout out if there's any particular things you want added to this list. Some of the details here, I think Sean towards the end of the presentation will put her email details and email details for Barbara Goss, who is leading a big piece of work for mental health for NHS staff in the southeast. So she will put the email addresses there, so that if you want a bit more detail about some of that work, you can contact either Sean or Barbara or myself as well. So yeah, let's move on to the next slide, please, Sean. Thank you.
Has it moved on?
Yeah, it has. It has. Yeah, I'm just waiting for people to read. I think some of us do most of these things, perhaps some a bit more than others. But good sleep, exercise, smiling. I think one of the things I perhaps don't do is a gratitude list, so that might be something for me to take home as homework. But I do in some ways do a mental list, but maybe I don't know whether we need to write it down to make it more powerful as well. So there are some websites we will share, some networking areas as well. Plus, I guess especially for people who might be doing a lot of working from home as well, that itself can also create difficulties. So there's definitely support available out there. Next slide, please. Yeah. No, sorry. I think we rushed there. Yeah. So we're talking about mental health and well-being hub. So this is the work I think Barbara Goss is involved with. Next slide, please. So this is again about some work that happened through COVID in terms of mental health impact. Next slide, please. So this is in a way a new program of work, still early days, but I think again this might be useful for all of us to know and understand better in terms of supporting our staff and our teams. Okay, next slide, please. And the way some of the support will work is through sort of layers of functions in terms of The first layer will be proactive outreach and engagement, then rapid clinical assessment, and then provide onward referral. Some of this work is still sort of being organized, but just to make you aware that that is the direction of travel going forward. Next slide, please. I think in reality, everybody in today's environment is at risk, but I think through NHS England, they have come out with particular sort of at-risk groups, and I will leave you to read this through when we share the presentations and the slides with you. But really, anybody in today's COVID world is at a risk group. Next slide, please. So this again will be shared. These are useful resources that people can. So Shan, I presume that all these links work directly by people clicking on them.
They do. So when we share this, you'll be able to.
Yeah. So as long as when we share them, people can access them. Yeah, that would be useful. Thank you, Shan. Yeah, next one, please. Next slide, please. This again is something I don't know a lot about. This Charlie, do you know much about this program?
Shape? No, I've not seen this one. I'm just listening. I'm just wondering if you've all got access to your own employee wellbeing services, like staff wellbeing services within your own trusts, because this is kind of centralised stuff, isn't it? Which sounds great.
Yeah, this is regional stuff. Yeah, all trusts will have their own, because sort of the 35 odd people who are on the call, they will be easily from 10-15 different providers. So yeah, so they will have access to that. Yeah, keep going. And then obviously we have some well-being apps as well. Sorry, go back. Yeah, sorry, keep going. Next slide, please. What I also wanted to highlight is a charity in Scotland. I think Bridget might know them, called Cope Scotland. And actually, I know the chief exec quite well. There's quite a few good resources on their website, partly in terms of courses, partly in terms of support. So feel free to browse through the Cope Scotland website as well. Bridget, do you know about this charity, or do you have any links with them?
I'm afraid I don't. Sorry.
Okay. No, that's fine. So it's in your neck of the woods. So maybe have a look at it. But yeah, if anybody goes on the Cope Scotland website and finds anything useful, or wants to do any further work, or needs any resources, please drop me a line. I'm quite sort of close to the chief executive. We're doing some work on network weaving with her as part of the Q community. So I'm more than happy to introduce you to the chief executive. Next one, please. Yeah. So Charlie, when you finish reading it, raise your hand so I'll know people would have read it. So the reason I put this slide and the next slide in is a lot of what we do for each other is to frame things in a better way, to change our perspective. Because when we have had a bad day, somebody has made a drug error, somebody has made a mistake, somebody had a bad encounter, or whatever, I think what we as colleagues, as friends, as family members do for that person is we make them understand that in a bigger context, in a larger context, it perhaps needs to be framed differently. So next slide, please. And that's partly that reframing is quite important for our well-being. So a lot of what we need to do for each other, for our colleagues, for our family members, is sometimes to frame an untoward incident or a difficulty in a bigger, different context, to change the perspective, and we always need each other for that. Next slide, please. I'm going to leave you with these two thoughts, and this is quite apt. We need a lot of compassion, we need a lot of kindness in today's world, the way things are going, and in a lot of ways that is the highest degree of wisdom we can achieve as human beings. And next slide, please. You all will have your to-do lists. You all would have reams and reams of paper talking about what needs doing. You might have stuff on your fridge. But this is really the to-do list that we need to have every day. I think in addition to the chores, in addition to the boxes we need to tick, this is really the work that needs to happen. And this is why we should be coming to work every day. So I'm going to leave you with that. If we finish off the slides, Sean, is there another one? I think there's another slide, Sean. Yeah, so let's open up to questions and have a bit of a chat. What I'm interested in is individuals talking about their own teams, talking about their own trusts, and seeing what are the things for staff safety and well-being that are happening, what works well, what doesn't work well, what are the things they would like to do, and let's open up the discussion for the next 20-25 minutes. And feel free to raise your hand. Sean, if I can't see the hands, just make sure you keep an eye on things. Thank you. While people are coming up with questions and stuff, Charlie and Bridget, any particular thoughts, anything else you want to talk about?
Just yeah, thanks for the slides, Minesh. I suppose the word that comes to mind, I suppose the other side of the coin of love is loss and grief, and I think that's really relevant to hold that in our minds as we're all experiencing our unique experiences of grief, but also a kind of collective grief around the ways of working that we've lost, people that we've lost, missing people. There's a whole layer of loss and grief, and I think we're coming to these resources and these quotes and these ideas from that point, and I think there's something about, yes, we can all do things individually, but how do we all be there for each other in that context?
Thank you. Jilly, you had put something in the chat box. Do you want to talk about PMA?
Yes, hi. Just to say that midwifery is lucky in having the professional midwifery advocate model, and it's something I know nurses are looking at too, because there's an opportunity to have at least 1 hour a year, and that sounds tiny, but not everyone actually accesses that. But a one-to-one, completely anonymous unrecorded conversation, except for the record the midwife wants to keep for herself. It's really useful, and I think it's quite telling when trusts don't employ a PMA. I kind of see it as a marker of a culture that doesn't want to invest in that way, and those trusts are often not doing as well in all sorts of measures.
Angeli. Tracy, your hand is up. Please go ahead.
You're on mute, Tracy.
Can you hear me?
Yeah, go ahead, Tracy.
I do apologise. Yes, so I agree with the last speaker. We have a PMA system in our trust, and it works very well. We have something called Time to Talk every week, where we invite all our colleagues along, and they are free to speak. But my question really was for Charlie and Bridget. I'm a fan of Nancy Klein and her works, Time to Think and More Time to Think. That's great. But my experience of that is that when we do a round, the 2 minutes for each person, if the person wants to pass, that's fine. But also if the person wants to have those 2 minutes of silence, that's also fine. Is that something that they would advocate?
I'm a big fan of silence. I think in the space of listening, people can use their 2 minutes however they like. Yeah. What sometimes does happen, it's not quite what you're asking, but what sometimes does happen is that if after a minute someone's indicating that they've finished, Bridget or I will prompt and say, you do have another minute if you want to say something else, and give people the option to say some more if they want to. Sometimes people take that and sometimes people don't, but if someone wanted to say, I'm just going to take a couple of minutes, that would be absolutely fine. Yeah.
Okay, thank you.
I think Jenny is next. Jenny, please go ahead.
Hi, this is more of a sort of observation, I guess, but because we're all working so much more like this, and it's really hard to read the room when we're having meetings like this, I think that's somewhere where we really need to be honing our skills if we're going to keep a lot of virtual working going forward. And so actually starting to capture some of the signs which could be worrying. So, you know, heavy sighs, people who are always on mute with cameras off. I know mine's off at the moment, but I am okay. I give you my reassurance. So I think there's some lessons for us to not just take these virtual meetings at face value, and also if we've got an audience or a group that's on mute with cameras off, we have no idea how much they're engaging with the meeting. So I think encouraging use of chat, for example, the chat box, checking in with people individually for responses like we might do if they were there in person. And just a reminder at the beginning that, because I think we've all got into dreadful habits of doing two things at once. So we're on one meeting, muted and no camera, and doing emails, but half listening. And I think we need to be being much more directive about, please be in the moment. Please, you know, don't do anything else while this meeting is be in this meeting, because I would always call it out if we were meeting in person. I hated people being on laptops in meetings, and I'd always say, please close them down. You don't need it. All the slides will be coming out, so that I felt they were being mindful in that moment. So I think as people that within this group that will all be leading meetings, I do think we need to work with what we've got really, and to make sure that we use that little we do have in this new way of working to make sure the people that we're working with, because things could get missed so easily, I think, at the moment.
Yeah, no, good point, Jenny. And I think again, yeah, these are new skills in a way we have to pick up now, isn't it?
Yeah.
this is a totally new domain of working. So I think we will hopefully get a bit wiser and more skillful with time. No, that's an important point. No, thank you for that. Who's next in queue? I think it's Avidya.
Yes, thank you. I think Bridget wanted to say something about the last comment. I'm not interrupting because mine is not related to that. Bridget, do you want to go first?
Thank you. Yeah, just quickly, a couple of points. I agree with what the last speaker was saying, and I would say one thing that people have said to us about Spaces for Listening, which is all done on Zoom with 8 of us, is that people have experienced that as qualitatively different to lots of meetings they're going to, because actually they do put aside their emails and their phones and WhatsApps and so on, and actually stay in the process. So a lot of people have taken from that practices that you're describing into other meetings and realized that actually it is possible to have a very high quality of connection in a virtual space. And I suppose linked to that, what you're saying about the practices we need to take forward, I've brought that into leadership programs that I'm responsible for saying actually this is going to be with us for quite a while. It's time to actually be much clearer with each other at the outset of a meeting or any interaction about almost contracting about how we're using things like the chat and how we're using the space. So just wanted to add those points in.
Thanks, Bridget.
Is it my turn now, Manish?
Yeah, go ahead.
Okay.
Yeah.
So thank you. It's very, very useful. I just before I go ahead, because the comment is related, not to everybody, but I'm Avida Najad. I'm one of the sort of consultant fetal maternal medicine in Hampshire hospitals, and I'm the clinical director for women health, including obstetric, gynecology, breast, neonate. So anyway, I'm coming from another angle completely. I know that how my midwifery colleagues are lucky to have advocates, support. They are one team. What I find it is, and of course, every trust by now have got this well-being hub. We put so much resources to set up such a thing, but the fact is, junior colleagues, if I say the senior health officers, the F1-2 and F1, getting them engaged in these hubs, or even senior colleagues, getting them to say that this exists, please use these resources. It's a stigma somehow in our profession that as a senior person you should not ask for help, or you should be okay. So probably, Minesh, we need something that driving the senior team to be able to say, use these resources, whatever. It's good to put 10 websites across in each meeting and saying that you can do this, you can whatever. But for instance, for me, until somebody told me that there is a yoga session on Tuesday between 4 and 5 through Zoom for you guys, do you want to use that? I didn't even bother to go to the Wellbeing Hub and to say, I'm talking about myself. And this is a very, very common theme about the medical workforce. Juniors have some other issues, and senior, who cares about it? So I think in this type of when we as this team, we are planning to help our staff, to get them engaged, we always need to think about, we are not treating everybody the same. For instance, out of your presentation, what really interested me was to use for my colleagues or across the organization is this one-to-one mentoring on the phone. So I never heard that before, or coaching or whatever. So that is why specifically, these are things that might be different from the interest of the other groups. And this is my first point. And my second point is, actually, occasionally, when there are too many cameras on, depends on the size of the meeting, you just get distracted rather than focus on. You have to always think about the other side of the story as well, rather than, I get your point. You can believe me, I have another laptop here and I have another laptop there. So yes, I'm hands up. So I'm not answering the email because hopefully I'm focusing, there's something interesting for me. But if there is nothing interesting for me, oh God, who bother? So basically, I better be ticking the box. So that type of thing. So that's all my 2 comments. Thank you for such a useful slide, such a useful meeting. And thank you, Minesh, for your last 2 slides. This is really great. Thank you.
Thank you. No, a couple of things, and then I think Charlie, go ahead. You go ahead, and then I'll come in.
I just love what Avida just said. I love the honesty and great. I would say, I know you weren't seeking a response particularly, but I think the most persuasive, if that's not quite the right word, but thing that senior medics and senior colleagues can do in these situations is to say, I've used that service and I found it really helpful. We're having a really hard time at home at the moment, trying to homeschool our kids and lead us and set the example that it's okay to express, I suppose, compassionate leadership we'd call it, wouldn't we? And so rather than putting our emphasis in, you should go and talk about our own struggles and our own difficulties, because we're all people trying our best.
No, I think well put, Charlie. So yeah, thank you, Evita, for raising those couple of issues. I think we have to role model this when we talk about leadership and compassion in leadership. The only way to do it is to show people, because when we say juniors or relatively less experienced people than us, they will do what we do rather than what we say. So I think it is action. Action is the most powerful way. What I might suggest is a lot of trusts now have forums for junior doctors, and I think it might be useful to introduce so things like listening spaces for in those forums, so that people can get into the habit of listening to each other, looking at difficult signs. And I think it will happen slowly. I think it is largely because a lot of us, especially in the medical profession, got trained in a particular way to always I think showing vulnerability as a human being is actually a very important aspect of leadership. Leaders who don't show any vulnerability are not human, really. So you don't get a lot out of them. So the real leaders will show. It's not a matter of weakness. It's a matter of humanity. So I think that's the way we need to frame it. Thank you for your questions. We have another 5-10 minutes. Any other question? Anything else people want to talk about? We might have a few heads of midwifery on the call. Would you mind maybe sharing with us in terms of your teams what sort of safety and well-being work is happening within your organizations?
Hi, can I'll speak. Haven't got a camera. I can't put my hand up on my device.
Yeah, go ahead. Sorry, please introduce yourself. Sorry, I can't see you.
No, it's fine. I'm Nikki Sheppard, Interim Director of Midwifery for Epsom and St Helier. We have got a huge amount, and I'm sure this is the same for a lot of the trusts at the moment. I think this is a real key thing for us, is the support of the staff. They've undergone a huge amount of changes in a very, very short period of time in their lifespan, over the past year. And our occupation, we're very lucky to have an occupational health and an HR department that have been literally zooming in on anything that's available and pushing it out to staff on a daily basis. So much so that we've even got one of the airlines at the moment giving us a free bus outside the hospital for safe spaces for staff to go and lay in and have talks in their lunchtime and break times, just so they've got a space to go away from the clinical environment. And I think, a lot of it is just about them or staff knowing that we actually care, that we're thinking about them. That I think there is so much, and people will access what they feel they're able to, what they're going to get the most benefit from. Some people prefer to do things on an app in the safety of their own home, and some people like to go to face-to-face things. So there is certainly something for everybody out there. My only concerns are we actually reaching everybody? So we do a lot of one-to-ones with staff to actually ask them that. Are we giving you exactly what you need and what you want? But I think there's always going to be that unspoken group, and they're the ones that really need it, and they're always the ones we never eventually manage to get to. So I think it's just a case of keep going, and keep giving. I think is all I can say, that is what we've been trying to do.
Thank you. That's very useful. Thanks for sharing. Anybody else?
Sorry, Minesh, it's Leslie from.
Yeah, go ahead, and then Bridget will come in. Go ahead.
I was just going to pick up on what Nicola was saying, and really an observation that there are across your systems, there's going to be more vulnerable groups, whether that's people that work part-time or on nights, so they're not around, during the day when maybe they can access some of the resources that are out there. And it sounds like they're doing really good things in your trust, Nicola, but I was just curious how they got started, and also how they communicated what they were doing, because I think that's often the challenge, isn't it, is making people aware of what is available, and just getting some involvement or interest.
Yeah, I think ever since the pandemic has started, I think one thing that we have noticed is staff are much more keen to read their emails. They seem to want to know what's going on. So that's a format that we've used. We've also got closed Facebook groups for staff, where there's an awful lot of WhatsApps that go on in, different areas. So we try and, just literally wipe it across everyone's agenda. So I would say the majority of it is going out via the trust. We've got a newsletter, we have risk newsletters. So it literally goes in everything. So you can't look at much without seeing some form of contacts. And so we've got daily emails coming out from our occupational health department with a list of all of the different things that can be accessed.
Thank you. Bridget, you wanted to add something, please?
Yeah, it was just for information, Minesh, just to let you know, Charlie and I have been in touch with Barbara Goss and Carol Cookseer in her team, and we're both going to be speaking at the Health and Wellbeing Leads meeting on the 2nd of March. So it's just to kind of make that connection around Spaces for Listening, obviously, and both of them have experienced it as well. So
that's useful. Yeah, thank you. I think that sort of closes the loop, so to say. Isn't it? That's good. Any other final thoughts, comments, anything anybody wants to share? Last couple of minutes, guys. Anybody else's hands up? I cannot see.
No.
Charlie's hands is up. Yeah, Charlie, go ahead, please.
So just in the spirit of what we've been saying, Minesh, how are you?
I'm okay. I'm okay. I am sort of I can perhaps share it now. We lost one of our maternity porters a couple of days back to COVID. He had been battling for 4 weeks, and the whole team, including myself, are quite a bit down at the moment in relation to that. So in a way, I can use this forum and all of you to pass on our condolences to the family. He was a lovely man, Christoph. He was a really lovely man, always had a smile on his face, and the whole maternity team really loved him. So yeah, unfortunate times, difficult times, but I guess that's the way COVID has treated all of us. Andrea, your hand is up. Please go ahead. Is it Andrea's hand up, or am I making a mistake? I think on my system it seems to say. Deshan, can you see whose hand is up?
There's nobody's hand at the moment, Minesh.
Okay, so it's something with my computer. Okay, so let's unless there's any new queries, let's perhaps bring the session to a close. May I thank Charlie and Bridget again for your time and your wisdom today, and I'm sure people will be in touch with you, and I'm sure we will be in touch separately with each other as well. So have a lovely rest of the day, and again to all of you, thank you very much for all you do. Please come back to us if you have any particular queries or questions with regard to today's content, but the recording and the slides will come out in a short period of time. Thank you again and stay blessed.
Thank you, Minesh.
Thank you.